Okay, so this topic is about crown lengthening. Now, some of us may have known what is crown lengthening. For few of them, it may be a new topic. What is crown lengthening procedure, which is concerned with periodontics. Now, what are the options of which we can restore this tooth? You can see a deep caries in this region. That is a canine, which is having a deep caries. So, how we can give a crown in this case? So, actually, we can give crown by two methods. Ideally, giving a crown for which we requires a margin. So for creating a margin, we can either shift the gingiva or we can shift this whole apparatus to the apical side or shifting the apparatus to the coronal side. Okay, so by shifting it coronally or by shifting it apically. Now, what are the methods by which we can shift or we can place the crown coronally? We can build up a post and core, or we can give a metal coping, or we can do an orthodontic extrusion. Now, which are the options by which we can get the margin apically by doing surgical procedures, periodontal surgical procedures like apically displaced flap or gingivectomy. Now, what will happen if we give a crown? Say if we manage to give a post and a core in this situation, and we manage to give up a crown. Now, what is the situation that can happen? Okay, so whenever the patient, we know that it is a single crown and we know that it is a canine tooth. So if the patient attempts or if the patient chew on some food or had a bite for some, they say even for a biscuit. Okay, so they tell that even the crown got fractured like that. Okay, so what happened? We must have given a good post and core restoration. We may have given a good crowns, but what happened for the failure of this restoration? The main two factors that is concerned for this failure is due to the fracture of the crown, due to the violation of the furrow rule, or due to the consequence of biological width. Now, first one, what is a furrow? In order to give a proper crown for a tooth, it needs a 360-degree collar of tooth surface has to be present. So whenever we give a crown, we should make sure that there is a proper sound tooth structure that is present in the tooth. Okay. So in the first picture, if you remember that the tooth margin, we cannot see them at the buccal area. It is much subgingivally. So if you remove, if you have managed to do an endodontic treatment and remove the caries and all, but the subgingival margin is not exposed. So it is an arbitrarily we will be preparing that area, and the whole restoration, the post and core will be inside subgingivally. Now, when you give a crown, what will happen if you manage to do it subgingivally? The crown margin will be inside the within the restoration. So that is the reason of the failure of this in this condition. So we should make sure that our margin, the crown's margin, should lie on the sound tooth structure. So if there is caries, you have to remove the caries, and then you have to prepare. You should make sure that there is sufficient bone, sufficient tooth structure that is around. So a furrow, in respect to teeth, it is a band that encircles the external dimension of residual tooth structure. To be simplified, that is, to give a crown, you should require a sound tooth structure. So when you're attempting a crown into the situation, the post and core is not a solution for these cases. So we have to have a sound tooth structure. Now, this is again a figure that is showing the importance of tooth structure. The gray area is the tooth structure, sound tooth structure that is present. So we can see that the crown margin is below the gray area. The red portion is the post and core region. If our crown margin is lying at the red area, that means it is lying at the restoration point. It is a weak, it is having the weak structure. So whenever the patient tries to beat it, bite the foot, this will fracture. Okay, so this is what is like an what a tooth which is having the furrow, good furrow and restoration and a post and core, or here a core window. Now, the second reason for the failure is maybe due to the biological width violation. We know that what is a biological width? Biological width, it is the distance of the junctional epithelium and the connective tissue. Okay, so what is the normal biological width measurement? That is 2.04 mm. If at all we are managed to give a crowns subgingivally, again in the first figure, we have removed the caries, and we may give for getting the margin, we may give a subgingival preparation. Now, what will happen when you give a subgingival preparation? You will be violating the biological width, that is the 2.04 mm or more of the biological width area is not present now. So the body will try to maintain the biological width. The biological width area is to be present in a tooth for a healthy, long run time for that tooth to go. So that the biological width is very much important. Whenever if you are trying to violate the tooth by subgingival restoration, the tooth, that area, there will be inflammation or there will be cyanosis. You can see a cyanotic area also if you give some crumbs and all. Okay, so that is a type of violation. Now, that is the initial stages. Now, with time, it can proceed to up to gingivitis. Gingivitis may even progress to periodontitis, or in which there can be weakening of the tooth structure itself. So, biological width, it is a natural seal that develops around both, protecting the alveolar bone from the infection and the disease. Okay, so what is the definition of it? It is a dimension of soft tissues which are attached to the portion of the tooth coronal to the crest of the alveolar bone. Now, this is the figure that is showing the biological width. Biological width is the area of junctional epithelium and the connective tissue, that is 2.07 mm of that measurement is known as the biological width. If you like to give a subgingival margin, this area can show biological width violation, which is maybe of an inflammation or cyanosis. So how can we restore? So we don't have an option of correcting this in this case of a coronal type of correction. One was the post and core, then was the metal coping. For these two, they need a sound tooth structure. The other one was orthodontic extrusion, which may not be useful in every situation. There are situations in which you can do orthodontic correction, but you have to check for the apparatus, gingival apparatus, bone, everything. Then only you can give. So, in this case, we may have to go, if the patient wants to retain that tooth itself, the patient may have to go for an apical correction, that is by a surgical crown lengthening procedure. So this topic is mainly about surgical crown lengthening. So don't think that crown lengthening is mainly by surgical crown lengthening. It has another options of post and core and other methods, but now we will be focusing on the surgical crown lengthening options. Now, D.W. Cohen in 1962 has introduced this concept of surgical crown lengthening. Now, at that time, it is about 10% of all periodontal surgical procedures. But now we can say that there are a lot of cases that has been referred for crown lengthening procedures, because they have understood the importance of what is this surgical crown lengthening. procedures. But at certain situations, we cannot what attempt and surgical crown lengthening situations. We'll be explaining what are the situations in which we cannot do that. What are the rationale of doing this treatment? It is re-establish the biological width in apical position to avoid violation that result in bone resorption, gingival recession, inflammation, or hypertrophy of the gingiva. Now, what are the factors that determines whether we are able to do or what type of surgical crown lengthening procedures we can do? Now that we have only the apical option is present. So, in the apical surgical crown lengthening procedures, maybe it is by gingivectomy or the apical displaced flap or normal flap. So, what is the deciding factor for that? That is mainly by the attached gingiva and the bone sounding. That is at what level the bone is present. Now, depending upon that factors, we can decide whether we can go for a gingivectomy or whether we can go for a flap surgery. If the attached gingiva is inadequate, we cannot go for a gingivectomy. In these cases, we have to do a flap surgery, and that too, a more apically displaced flap is much preferred. Now, for the evaluation purpose, first we should have a clinical evaluation, radiographic evaluation of the tooth. Then we require a pre-surgical evaluation. Now, for this clinical evaluation, you should check for the clearance. What is the clearance of the tooth area? Then the adequate whether the tooth is having an adequate clearance even after the surgical crown lengthening procedure. Then any pathological defects that is present during the radiographic evaluation has to be done, because after the crown lengthening procedure, if there is pathological reasons that can aggravate. Also, the pre-surgical evaluation, like the normal, what is the systematic condition of the patient, all the routine steps that we have to follow for a surgical procedure has to be followed. Okay, so we have to determine the provisional restoration, determination of the occlusal plate, aesthetic evaluation. So according to that, we have to modify the surgical techniques that we are following. Evaluation of the gingival morphology. What is the biotype of the gingiva? Whether it is thick or thin type of biotype. Now, one more thing that we have to know is that about that altered eruption. What is an altered eruption? That is, if a tooth has been erupted to its normal level, but even though the gingiva may not recede back. Okay, so if the gingiva may not recede back, that means that much of gingiva is a pseudo pocket. So we have to correct that by the procedure known as gingivectomy. Now, if we have a bone just beneath the CEG, in rare situations it can happen, then we may have to go for an ostectomy procedures, by which we reduce the bone to the normal bone length and then do the gingival correction. Okay, so these are the mainly gingivectomy or apically displaced flap. Just remember that if you have adequate attached gingiva, then only you can attempt a gingivectomy. Otherwise, we may have to undergo for a flap surgical procedures with osseous recontouring, with maybe apically displaced flap. Now, what is the procedure? Preoperative temporization. So, do a preoperative temporization, then incisions has to be made. Then it may have to extend to the anterior or posterior tooth of the affected region, and intracircular incision if that gingiva is very minimum. Then the flap is protected, adequate bone correction is done. Then a scalloping is done, buccally and lingually, or according to which area we have to address. Then return back the flap, and if any modification the flap has to be done, that we have to correct. Then do the suturing. So this is a case in which there is a sound tooth structure that is present. This is after the flap surgery, that is after the suturing. We can see the sound tooth structure. So we know that in this situation there is furrow. There is a good amount of furrow that is present that we can very well appreciate. Okay. Now, what is the healing after the crown lengthening? Now, healing after crown lengthening mainly depends on what type of procedure. That is, if we have done, that is a common question that is asked by the clinician, that when we can give a crown after the crown lengthening procedure. So again, it depends upon what type of procedure we have done, whether it is due to an gingival, only a gingival correction, or whether we have done a bone correction, that would be depending on that. For soft tissue correction, maybe a 7-week healing is fine, but according to literature, it says that the crown lengthening after the osseous correction, we have to wait for a period of 3 to 6 months. Okay, so now these are some of the cases in which we have done a crown lengthening. Now, for these cases, it is not for the prosthetic portion. We have done this crown lengthening for aesthetic purpose. That is, the crown portion is, as we can see, is with the pseudo pockets. Now, we have done a gingivectomy in this case, and now we can see what is the healing after 1 month. 1 month healing is this. Now, here we have done just a gingivectomy. Now, this is another case in which we can see that the crown height, the crown height is very much low. So, if we manage to give a post and core and all, again after the preparation, we may not get a good tooth structure. So, in this case, we have done crown lengthening. The bone contouring was done, and we can see that how much of tooth structure that has been gained. Now, the third picture is after the healing. That is, I have waited for 1 month, and this is after the healing. Then we have given a temporary provisional restorations for the healing period. That is, they say it is 3 to 6 months. So we have given a temporary provisional restorations, and after that we have given a permanent prosthetic restorations. Now, this is again another case in which there is subgingival caries. You can see there is subgingival caries that is extended. Here, the flap is raised, bone contouring that is in the required site we have done. We have removed the caries, and here, how can we restore the tooth? If it is in the first photograph, according to the first photograph, it is subgingival, and mostly in these cases, it is the aesthetic demanding area. They may require for a composite restoration. But for composite restoration, if at all we try to remove the subgingival restoration, there will be bleeding. It will hamper the isolation, etc. So first we have done an app incision, and we have reflected the flap, and in areas with bone corrections, we have done the bone corrections, and then the caries was removed, and gingival restoration was done, and afterwards the patient has undergone composite restoration, with which we get a much pleasing smile for the patient. Okay, so this was the initial smile, and this is the final smile. This is just, we have done no prosthetic FPDs or something. We have just done an composite restoration. But since this is subgingival restoration, we may have to address the bone also. Now, to summarize, what are things we have to know that? First of all, we have to know that there is an option like this. So all root stems need not to be extracted. There is an option of crown lengthening in which we can retain a lot of tooth. Not all the tooth, because if the tooth is having any pathological reason, or if the tooth is having any fracture or something, we may have to go for an extraction. So first of all, we have to imbibe that there is a procedure like that, and then only we will start to motivate the patient. Okay, so we have to keep in our mind that there is an option of crown lengthening also for retaining a tooth. Now, the advantages of retaining a tooth must be weighed against the extent of all procedures needed for restoring. Okay, we may do a lot of procedures, but just think that whether this tooth is worth for that, or may have to undergo for an extraction is the best option, then or implant therapy, or whatever options they are patients opting, that we have to know. We just know what is beneficial for the patient. Okay, then we have to do a pre-evaluation methods, that is occlusal clearance and everything we have to determine. Then only we can go for this option. Then we should know the importance of attached gingiva and bone sounding. What is the level of bone? and what is the attached gingiva whether present. I told you in all situations we cannot do a crown lengthening procedures, especially in posterior tooth. If there is inadequate attached gingiva, we may have to even we may not be able to even do a crown lengthening procedure. So it is not a solution for in all cases, but in certain situation definitely it is an solution. Now, also we should know whether when to do an ostectomy or when to do a mere gingivectomy. Now we have to modify the suturing technique also in certain cases, and you should give a proper healing time. So there are situations in which the patient will be in a hurry, the patient will be coming, they will be doing him a crown lengthening. The next day the patient have to go for the crown. No, this option is not like that. If there should be ample time, there should be sufficient time for the healing, then only you can give for the prosthesis. Otherwise, what are the other side also we have to face. If the patient is in a hurry and we also just sticked on to it and gave a crown, the healing is not complete. So if the healing is not complete, there is chances of recession and even other periodontal problems that can occur. So ideally, the healing period for gingivectomy may wait for a 1.5 months, and for the ostectomy procedures it may extend up to the 3 to 6 months, and of course it depends upon what all type of procedures that we have. Okay, so to summarize, at least know that what is the importance of crown lengthening, that is clinical crown lengthening procedures. Many of us may be knowing what is coronal corrections of clinical crown lengthening, but surgical crown lengthening option we have to know. We have to give to the patient this option. There are patients in which they tell that I have to retain my tooth, not extract my tooth. So definitely, if there is no other pathological reason, we can definitely go for this option. Okay, so that is about crown lengthening, and that too specifically about surgical crown lengthening.